Hi, everyone. So excited to be here with you today and talk about a topic that is super important to me. It's all about unleashing practice growth and transformative tech to grow your practice. For those of you who don't know me, I'm Dr. Sonia Chopra. I'm a board certified endodontist. I graduated from dental school back in 2003 from the University of Maryland. After that, I moved to Brooklyn, New York, and I did a 1-year GPR at the Long Island College Hospital. I stayed in New York City to work as a GP for a while. That's where I realized that endodontics was my one true love. And I went back to school and completed my endodontic residency at Nova Southeastern University in 2008. From there, I moved to Charlotte, North Carolina. I didn't know a single person. I started my own practice, and that practice is called Valentine Endodontics, and I have been there ever since. And along the way, I realized just how much I wanted to teach endo because I love endo. So I am the creator and founder of eSchool, Everyday Endo Made Easy, which is my online endodontic education platform. And in the midst of all that madness, I became a mom of 3. So pretty busy lady. So full disclosure here, I am a KOL for Sun Endo, J. Merita, Dentsply Sirona, and Kerr. But I do want you to know that everything that you see here in this presentation is my own experience, my own journey, my own compilation of my cases. Nobody has influenced me in any way. And so I just want to share with you where I've been and how far I've come and just make you aware that this is just me talking. So this presentation is really an update. It serves as an update to something that I have been talking about for quite some time. Back in 2016, I actually experienced a significant burnout in my practice. I was unfulfilled with my career. My practice was stagnant. I really was in this space of darkness that I didn't really wish to be a part of anymore. And I knew that I had to do something about it. I couldn't continue living my life that way. And so what I did is I zoomed out of all my problems and I created this vision and I started to look at things and started to see, where can I make change? Where can I start to shift things so that I can find that happiness again? And so I looked at things like the time that I was spending in my practice. I wanted to see how many days that I really need to be working in the business. Did I need time to work on the business? And was I feeling like I was working too much and I was doing too much? And the answer was yes. And then I looked at the culture of my team and I wanted to make sure that I didn't have any more drama and that I was creating a team of leaders and that I was empowering others to help take things off my plate. And I wanted to make sure that my team was fulfilled along with myself. I then looked at production, and although I was technically a successful practice, I wanted to see if my practice could grow and hit new ceilings. So from this vision, I really had to look at things. I had to look at the beliefs that I currently had and my mindset and understand which beliefs were helping me and serving me and which beliefs were getting me, not allowing me to achieve my vision. They were actually getting in the way of allowing me to achieve my vision. And from that vision, I had to make sure that I reframed my beliefs that allowed me to achieve that vision, but all of that aligned me with my purpose. And from there, when I put these 3 things together, from there, I could create a strategy. And the strategy that really worked for me in the beginning was the strategy of technology. And so in the beginning of my career, I started out, just like most of us here, with just working in a dental operating microscope. That is what I was trained on as an endodontic resident, and that's what I carried through into my practice. At the time, you can probably appreciate that this was something that changed the game for endodontists. Well, then if you fast forward into my dental career, I started to adopt more technology like the cone beam, and this came into my practice in 2012. And again, it shifted things and it changed the game for me as an endodontist, allowed me to see better, allowed me to predict better, allowed me to make better clinical choices for my patients. And then once again, a very important piece of technology came into my life, and that was the GentleWave. All three of these things, when put together, create this synergy that is what I call the modern day root canal. And if you think about what each of these pieces of technology did to endodontics, they were all disruptive. And I love disruptive technology. Disruptive technology is an innovation that significantly alters the way that consumers, industries, or businesses operate. A disruptive technology sweeps away systems or habits it replaces because it has attributes that are recognizably superior. And this is really important. It's really interesting how GentleWave came into my life and totally disrupted everything. It disrupted my way of life. It disrupted the way that I think. It disrupted the way that I clean. And now it disrupts the way that I live, and in a good way. And we can look at that disruption as a negative, or we can shift our belief and understand that this disruption is a true gift. And that's what I want to focus on right now. I didn't realize what this experience was really going to do for me and my patients. And the first thing you start to kind of become aware of is that final radiograph. Here is a perfect example of a case where I had this tooth that I was working on, tooth number 15. I did a root canal, and I didn't even realize the impact that I was having on this patient until I finished the case. I could not see this MB2 in here with my microscope. I could not identify it on a cone beam. I had no idea that it was even in any existence until I finished the case. And this kept happening to me. It happened to me again here. Middle mesial canals are something that I did not appreciate were so prevalent until after the GentleWave. And again, here's another canal that I had no idea was even in existence until I finished the case. These things kept happening to me over and over and over. This is not an area that a rotary file can get into, or my hand irrigation. So my traditional methods, although they were great, they were good. My traditional methods were good, but I wanted to be great. And so here you see the lesion, and then a year later, you can see that healing. But again, if I hadn't gotten in here, I would not have had saved this tooth. Sometimes you can see things on your cone beam. This is what I mean, like there's a synergy behind all of these pieces of tech. And sometimes you don't know which piece of tech is really going to be the winner in that case. In this case, I knew that my cone beam identified this untreated part of the canal. I couldn't see it in my microscope, but because of my experience with the GentleWave, I decided to just trust my technology, allow my technology to do what it is here to do. I just run it. I don't need to find this with a rotary canal, and I can clean it. This can be instrumented and it can be obturated. Here's another example, and this is where my GentleWave experience has really built a new level of trust in me as a clinician. This was a retreat, and I was not sure what I was going to be able to deliver for this patient. I could see that the previous operator had difficulty getting into this canal. They found the MB2, but they didn't get patent. It's clearly and visibly short. And so I thought, okay, there's going to be just its own portal of exit here. I need to make sure that I get that. However, while I was instrumenting this case, I could feel that my MB2, my rotary file went into the main MB1 canal. And I got bummed because I was really trying to save this patient from having a surgery. I don't love doing apicos, and therefore I want to prevent my patients from having apicos. And that really bummed me out. But you know what? I decided it's not over. The case isn't over until I GentleWave it. So I GentleWave this case, and then I decided to take a post-operative cone beam, which I have started to do because I want to have a deeper understanding of the impact of my technology on my patients. So here is the cone beam after I did this case with the GentleWave. And you can see here that MB1 canal, and you can see how I felt my MB2 joining the MB1. After that, I ran the GentleWave and I trusted. And you can see why I trust, because it was able to instrument this offshoot to find that portal of exit that I couldn't do, and it was able to clean the tooth. Fast forward, and you can see that that bone is healing beautifully around this root. It's not done yet, but it's taking its time, but it is getting better, and that bone is regenerating. So now I just trust my technology, and I've had a mindset shift. I understand that my GentleWave is not just irrigating for me, it's also instrumenting for me. So having this mindset shift is really important to understanding my beliefs of my technology and the value of my technology. This has transformed into me really understanding my outcomes and what has happened as a result of this. And just, it happens when you utilize your technology enough where you're like, oh, my root canal is just not good without it. And you have to use it on every case to start seeing these outcomes consistently. So I won't do a root canal without all of these pieces of tech in place now. And once I started to do that, I started to see the value. And I know there comes a lot of fear or maybe hesitance to maybe charge our patients for the GentleWave and for the technology. But once you start to see the value that your cone beam brings, you're going to be okay charging for that. Once you see the value that your GentleWave brings, you are going to charge for that. I truly believe that the outcomes that I'm now delivering for my patients is far more superior than what I was doing prior to having this technology. And if it were my tooth, I would want the GentleWave, and I would want to pay for that technology to be used on me. And when you start to believe it yourself, then the fear of charging your patients goes away. Your fear of, of anything goes away, and you can have a better conversation with your patients, and that energy of that belief transfers to your patients, and they are not upset paying for what you believe in. So I started to see the value of what I was providing for my patients over and over and over again. This also allowed me to start to understand what I was missing. All those times where my root canals didn't work, even though I really utilized the technique that I was taught in my endodontic residency, sometimes things didn't work out. And I couldn't understand why my treatments were failing. I followed all the rules, I did everything by the book, but it still wasn't working. And I started to consider myself as a failure in those moments. And that's really not what was happening. I just simply didn't have the resources at the time. And now I get that. And that means now I trust my technology. I actually won't do a root canal without it. I want to use the technology in every single case. And this belief in me started to empower my team. And that is so important, because once the team gets empowered, they are the ones that are on board to help you serve your mission. And then all of a sudden it becomes a team-driven approach, and everything doesn't rely on the doctor. So I went back to my beliefs, my vision, my purpose, and made sure everything was in alignment. And I was like, okay, well, what new strategy can I create? And what is my goal? How do I want to craft not just my practice, but my life? And my goal became, okay, I don't want to work like a dog. I want to provide value. I want to have amazing patient outcomes, but I want to do it in less time. And so is there a way that I can do my work instead of in 5 days a week? What if I can do that in 5 days a month and not drop any revenue? And while I'm at it, what if I take the month of July off? Can I do this without losing my revenue? And so I'm going to share with you some numbers, because I think numbers allow you to quantify that impact. And I like to be transparent. This is not to say that I'm all about numbers. I'm actually more about the patient outcome than anything. But wouldn't it be great if we could increase the revenue in our practice and still increase the outcome for our patients? And I will say my outcomes have gotten so much better, but so is my revenue. And that's where I want to hang out. I want to be able to knock both of those things out with the way that I work. So this is my pre-GentleWave schedule. And I think it's important to point out a few things. Here I was working 7:30 to about 4:30. Okay. I was seeing 1, 2, 3, 4, 5, 6 patients, but 2 of these were complete patients. So these 2 appointments were 0 production that day. Because I was doing 2-step endo, okay? Really important to note that, okay? And if that translated over into the revenue over here, I was basically collecting $6,400 that day. And at the time, I was really proud of that production number. But I also thought I could do much better. And I thought, well, maybe I should set a goal of 10 grand a day. I think that's a really good goal for an endodontist. So that's kind of where my mindset was at the time. So this is July of 2018. I implemented the GentleWave in October of 2018. Fast forward to December of 2018, and now I've stopped doing 2 visit endo. So now I have 1, 2, 3, 4, 5 cases, and these 2 are now start cases. So these are full production cases now. I don't have anything that's not productive on my schedule. So you'll see I didn't do everything all at once. I do things a little bit at a time, but I continue to grow with time. So this is not something that will happen overnight. But again, as you pay attention and you become aware and then you become intentional, you'll see the growth. Okay. And so now I'm still working 7:15 to about 4:15, so about the same schedule. But if you look at the numbers, I'm now at 8,500 collections. So already I've grown by about $2,000 a day. That's a huge improvement. So I started to engineer my template. I said, okay, if I really want to achieve this goal of working less, but making the same amount, I need to start consolidating my days. Well, maybe I can work a little bit longer, because if I went home at 5 p.m., I was just as exhausted if I went home at 7 p.m. So I'm just going to try to consolidate my days. And so I started working from 7 to almost 7, so 6:45. And now I have 1, 2, 3, 4, 5, 6, 7 treatments instead of 5. And I still have these consults. I think I also increased my consults as well. But this is my new template that I want my team to follow. And this not only preserves production, patient outcomes, but also my energy. And then when we look over at the revenue side, now this is March of 2021. So again, I'm learning efficiencies this whole time. And the only way I'm learning those efficiencies is because I'm using the technology on every case. And then I'm applying. And so now you can see in one day, I'm almost at $16,000. That's 2 days of production in one. So already I can see myself hitting the goal. And then I was like, whoa, wait, hold on. We have to stop there for a second and just acknowledge what just happened. I blew past the $10,000 goal. I blew past the $15,000 goal. And I thought, oh my gosh, that's my ceiling. That's my new ceiling, until I kept doing it. And I realized I can go even beyond the 16K goal. And the one day that made me realize that I don't need to stop growing was the day that I hit 18,000. That was eye-opening for me. And so I went back to my beliefs, my vision, my purpose, and my strategy. And I went back to setting a new goal. What if I could do the $20,000 a day goal? Let's see. So I want you to watch the evolution as I start to pay attention and I start to be intentional with my time, with my team, teaching them, empowering them, making a team of leaders. And here's my schedule. Here's me, I'm the pink side, and my partner is the blue side. And I'm sitting here trying to hit that $20,000 day. And I have one pink spot open. And what does that mean? It was a bummer because I was close. I went past the 18,000, but I missed my 20,000 goal by $164. And that's fine. And so I'm going to try again. But if I'm not aware of what's happening, I see that there's an open pink spot, an open pink spot. And if I don't do something to counteract those patients not showing up, and if I keep seeing consults are not showing up at a certain time, that tells me this is not a good spot for consults to come in. They should come in a little bit later, and maybe I should put a treatment spot here. So that's what I did. I put a treatment spot there, and look at what it did to my goal. I actually went over my goal that day. And I was able to fix it, which I think is super cool because that's what happens when you have the awareness. And then you can hit repeat. And so I went over my goal again. And then I thought 20,000 was my goal, but what about 21? What about 22? What about when all the pinks are full? What does that mean? And how can we make the pink spots full? It can mean 24. So maybe my new goal is 25, maybe it's 30, maybe I can stretch myself even more. But the point is, there was a time where 6,400 was my goal and 10,000 was my goal. But if you don't change your beliefs and your mindset and stretch yourself, you won't be able to understand your potential. And for me, the GentleWave did it because it came in and disrupted my whole way of life, and it offered me an opportunity to rethink. And so now on a bad day, my bad day now is a $20,000 day. So I think this slide says it all because it shows you what happened in our life from 2018 to 2023. I'm going to look here just so you can understand the collection because that's the true money that we brought in. We went from 2.56 to 5.13. We basically doubled our practice in 5 years, which is incredible. We went from 2.5 to 3.5 to 3.78, even in a pandemic. We went to 4.58 after that, 5.1. And you can see this is by using the tech over and over. And then even though we went up a dock and then went back down a dock, we still grew. And for me personally, in 2018, I was making $1 million for myself working 3 days a week. Fast forward to 2023, I was still making $1 million, but I'm working 1 day a week. So over the year, I basically went from 142 days working to 71. And half the time, I'm making more. We did drop some insurance plans. You can see that we have pretty modest fees for our molar, and the number of doctors pretty much stayed the same. We did go up, but then we went back down to 3, and we still saw tremendous growth. This is incredible. Again, if you change your mindset and if you change your beliefs and you just utilize the technology, it's wildly worth it. And I got to take a month off. So since 2019, I have taken the whole month of July off with my family, gone to places like Costa Rica, Switzerland, Tallinn, Estonia, Portugal, so many places. And for me right now at this stage in the game with my family, this is the most important piece of my vision. Okay, I want to shift gears a little bit. I want to take you clinical now. That was all practice management, but I do want you to believe that patient outcomes is just as important to me. So here's the first patient. This patient he's a 76-year-old man. He had no pain, but his dentist saw something on the x-ray. Now, what you're seeing here is a case from 2015. This was my pre-GentleWave era. This patient had no pain. His probings were normal, palpation was normal, percussion was normal, bite was normal. Obviously, he had no response to cold because he had a previously treated tooth. So I diagnosed this tooth as previously treated an asymptomatic apical periodontitis number 19. And his dentist just found this on the x-ray and referred him to our practice. Here's that pre-op blown up a little bit so you can see. I think everyone would agree that there's some poor instrumentation and condensation on the mesial root, and that maybe if we just achieve working length and patency here, we could probably heal it. I used to do my treatments in 2 visits, so this is the calcium hydroxide picture. And I achieved patency. I did everything by the book. I was very pleased, and I assumed that he was going to heal. The patient didn't really come back because he's not a patient who really feels any pain, so he thought he was fine. And of course, like most, he skipped his recall. But fast forward to 2023, and he's back in my chair. And he has a bigger lesion than ever before, even with my root canal that followed all the rules I was taught in residency. So I took a combi, and I didn't see anything that was like crazy. And I looked at all the views, and you can see that lesion is quite big. And this is really what apicos were meant for, okay? But I'm not really good at apicos. My partner doctor, she does them all. She loves them, so she ends up getting them. But if I can prevent my patients from having surgery, I want to. Mandibular surgery is not fun for me or the patient. And so I always want to prevent that. So I gave the patient his options. I said, hey, listen, I do my root canals differently now. I have totally different resources, but I can understand if you don't want to go that route. Typically, before this technology came into my life, we would have to do surgery. So I want you to understand your treatment options. You can either do a GentleWave retreatment, or you can do a surgical procedure called the apicoectomy. After I explained everything to him, he decided that he wanted to do the GentleWave retreatment. I said, okay, let's try it. Understanding that you may still need the apico in the future, because I didn't know what was going to happen. So this was my post-op of the GentleWave retreat. I decided to take a combi because I wanted to see the impact of my work. And I thought I was like blown away because I could see the connections. I could see that I had connected the dots. I could see that I had cleaned and shaped and treated in 3 dimensions, more so than I did the first time. And this is what I'm putting my trust in. And when I brought the patient back at 6 months, you can see, here's the lesion right after I finished the root canal, and 6 months later, he's healing. I did nothing different. I instrumented the same. I irrigated with my hand syringe the same. The only difference was that I added the GentleWave to my previous instrumentation protocol. And now we're seeing healing. And now I'm preventing my patients from getting a surgery. And here it is in the cone beam. You can see the lesion is getting better. I think in another 6 months, this whole lesion is going to be resolved. Let's look at another one of my own failures. This is a 66-year-old woman. Her tooth started to hurt the other day. Her probings were normal. Her palpation was normal. Percussion was tender. Bite was normal. And of course, she had no response to cold. I diagnosed this tooth as previously treated and symptomatic apical periodontitis number 18. This case came to me in 2017. Again, my pre-GentleWave era. Here's that preoperative radiograph. And I had retreated it in 2017. Fast forward to 2024, and you can see that she's got an even bigger lesion now. And there's the cone beam. So I gave her treatment options. In her case, it was, hey, do you want to try this retreat again? You want to save this tooth one more time using different resources, different technology, or are you done with the tooth? Do you just want to extract it? Because all of these patients have had a root canal. I've retreated it. That retreat didn't work. And now they have to have a third treatment for this one tooth. Luckily, she wanted to retreat. So I redid it. Again, I don't know the impact of my work until a year later. Since this was done in 2024, she has not come back for her recall yet. But my post-op cone beam shows the difference. And here it is for the pre-op for my second retreat. And here is post-op. And look at that isthmus. The GentleWave is cleaning the isthmus. And this is what apicos treat, the isthmus. But I don't know about you. I don't really love doing mandibular second molar apicos. And so I don't want to put my patient through that either. And if I can prevent surgery, that's what I'm going to do. So after learning from my own failures, I now know what to do on my patients. And now I believe in offering a retreatment even more to my patients with the GentleWave. So this is a 71-year-old man. This is not my root canal. His tooth started to hurt him the other day. Probings were normal, palpation was normal, percussion was tender, bite was normal, cold was no response. And I diagnosed this tooth previously treated and symptomatic apical periodontitis number 19. There's the pre-op. Here's the cone beam pre-op. There's a trend here. These mesial roots on these lower molars, always having this funky anatomy and these lesions. You can see there's an untreated distal canal, but the lesion is actually on the mesial, which is interesting. Here's the mesial, here's the distal, here's the untreated canal. These were found and they even go to working length, and the lesion is over here. So I redid the root canal. I did it with the GentleWave, and I took a post-op scan. So this is what it looked like before I did GentleWave and after. You can see just how it gets into the middle of those canals, those anastomoses. And again, you can see the distal canal was found here, but look at what else was found, the isthmus. I want to connect the dots now. So to me, this is disruptive technology. Disruptive in such a good way that it's actually been transformative technology for me. I not only think different now, I clean different, and I live different. And I'm proud to say that our practice has done over 8,700 cases. Thank you all so much for listening to this. It is a topic that I'm super passionate about, and I hope that this creates more and more awareness for all of these technologies, because it really is going to change our industry. If you guys want to get in touch with me, feel free to reach out to me on Instagram at Dr. Sonia Chopra. You can also email me at support@drsoniachopra.com. And if you want to learn all things endo, you can look at my website, drsoniachopra.com. Thank you so much.